Illness identification of children should be simple, but case reviews in our department highlighted that staff education, time pressures, and inflexibility of paperwork were common problems. It was also felt that significant numbers of very well children were being admitted unnecessarily, especially overnight, by junior medical staff. Our solution? This is a checklist containing routinely collected data. This includes the patient's saturations, the patient's work of breathing, the patient's level of alertness. Importantly, using the nurse's experience to judge the level of concern they have with the patient. It includes some other factors, such as whether the patient is on chronic steroids or maybe has diabetes. And it includes physiological data, such as the patient's heart rate, respiratory rate, and temperature. A numerical score is derived from these values, which enables a level of risk of illness in the patient to be obtained. The key aim of our implementation phase was to educate all staff to ensure a complete POPs was performed on medically unwell children presenting to the department. We tried a number of strategies, including a top of the POPs marketing campaign. This was a complete failure, as were other interventions which included posters and global emails, because these were often ignored. We moved on to targeted group teaching, with nursing and medical staff briefed during short teaching sessions during handover. These produced small increases, but they were failed to be sustained. So, an example of that is that the educational lead who just finished a teaching package, she will deliver the teaching package to members of staff in the department. Those members of staff who pass the package get a POPs badge, and then that POPs badge gets worn as a sign of someone who is POPs trained. It's just a little thing, but it seems to work. We have had success both in terms of behaviour, a sustained increase in the documentation of a complete set of observations, as well as function. No child with a POPs of 0 was found to have a serious bacterial illness, and overall outcomes. Ultimately, despite being a long-term endeavour, it proved fruitful, and further details can be found in the casebook.